I am Dr. Deepak Parikh, attached to the Lilavati Hospital Research Center in Mumbai, Bandra. I have been practicing cancer surgery for the last 40 years with special interest in head and neck cancers and a super special interest in laser surgery. Laser surgery is use of light in its powerful form focused onto a very narrow beam, and by means of this attached to different instruments can endoscopically remove the cancerous tumor, especially in the upper aerodigestive tract, that is the voice box, mouth, tongue, oral cancers, and at the base of the tongue and the supraglottis, which is on top of the voice box. On the occasion of the Cancer Awareness Day, I will talk to you about head and neck cancers and more also about the laser surgeries and how it revolutionized the treatment in cancers. Head and neck cancers is a very dominant, very prevalent cancer in India. The main reason is because of tobacco chewing, supari, that is betel nut chewing, which causes a lot of cancers of the oral cavity and the upper aerodigestive tract, that is the voice box, the food pipe. These cancers are preventable, obviously, when you avoid all these substances, including very hot, spicy, and chili foods. These are the changes that will occur when any of these are consumed in large quantities on a regular basis. As far as tobacco and betel nut is concerned, it is very important not only to curtail the use of that, to reduce it, but also to avoid it altogether. In the recent years, what we have seen is predominant use of this consumption and a high rate in especially the younger age group. So what we used to get cancers in the ages of 50s and 60s today moves down to the age of 30s, where cancers occur in young adults. Obviously, this is detrimental to the economics, to the cost of the expense and the treatment that the patient has to undergo. Early detection is the crux after prevention in trying to minimize the treatment for cancer. If the patient comes up early and is detected early, very often they are the pre-cancerous stages, which is white patches in the mouth, red patches in the mouth, a small ulcer or a small growth. When they present to the doctor early enough, all these surgeries can be done from within the oral cavity or through the use of the endoscope and a microscope using the laser machine. The predominant machine used is the carbon dioxide laser, wherein the tumor is excised intraorally, that is through the open mouth under full anesthesia, or in the voice box, or in the back of the throat connected to the microscope. The advantage of this is obviously that there is no external scars. Patient heals rapidly and can return back to his normal activities within a few days. Patients, however, present still dominantly in the stage 3 and stage 4, which fortunately for head and neck cancers is still good because they very rarely disseminate and go to distant organs like the lung or the liver, which then becomes fatal. These patients, however, now need to be treated with an open surgery, wherein not only is the primary tumor which has been involved removed, but even the nodes or the glands in the neck where it can spread. With the advent of extensive microvascular surgery, reconstruction, parts of the extra bone or the soft tissue from anywhere else in the body, like the leg, where you have the fibula, the small thin bone, or the radial forearm flap, which is from the skin and the thick tissue on the forearm, can be taken, and the blood vessels are sutured to the blood vessels in the neck, and so the reconstruction can be done. All these cancers, however, have a drawback because unfortunately head and neck region, as is obvious, is seen by everybody. So some scars, some marks remain, and so it is very, very important. Avoid all these substances as I mentioned earlier, but to repeat for the emphasis, avoid tobacco, avoid suparis, that is betel nuts, and spicy hot chili foods. If, however, you do notice a change, as I mentioned, like the white patches or red patches or small ulcer, need not necessarily be cancer at that stage, but that is the time to treat it to prevent the cancer setting in. So early detection, early diagnosis gives excellent results with least cosmetic defect. That is what the sum and substance for head and neck cancers I'd like to emphasize on the Cancer Awareness Day.